it is not time for a major reorganization of the entire system. But it is time that we began to decentralize. It is time that we started to ensure that we have regional health councils, advisory councils, and that we have local input in terms of how health dollars are being spent, all of that with a view to improving outcomes.
Like, what does that look like when you say decentralization and having local?
Well, in my view, there's been too much centralization in the healthcare system. There's been too much decision-making authority taken away from Albertans in their communities across this province. And so we need to turn back on some of that, and we begin to decentralize the system in terms of making sure that Albertans who are strong-minded people living in strong communities have a say in terms of what's going on in their healthcare system, how we're making decisions, all with a view to improving healthcare outcomes. I'm not talking about a major overhaul of the system, but I am talking about making sure that Albertans, rather than bureaucrats, are back in terms of providing advice and making choices of how we spend healthcare dollars.
Those advisory councils are already in place, and I guess by definition they're advisory councils. So how would they be different under a Prentice government to have more power? They will be empowered
to provide more direct advice. They will be empowered in a more specific context in terms of how resources are allocated. The reporting will be changed so that they're not reporting to the AHS, they'll be reporting to the minister, and they will have a direct and influential say in terms of how we administer healthcare dollars.